Hi, my name is Gabriel. I'm going to be your student nurse for the day. I'm just going to give us some privacy. Can you please identify your name and date of birth for me, please? Okay, so what we're going to be doing today is a head-to-toe assessment, which requires me assessing different parts of your body. Is that okay with you? Do I have your permission? Okay, thank you. So before we start, let me go ahead and ask you, in the past 2 weeks, have you had any thoughts about harming or killing yourself? No? Okay. So moving into the general survey of the patient's appearance, the patient seems to be the age stated. The patient's skin color is appropriate with his genetic background. The patient shows no signs of acute distress, and there's no visible equipment or devices seen that the patient is using. Moving on, the patient walking in today showed steady gait and full range of motion. The patient's body structure is normal. There's no obvious signs of physical deformities or abnormalities. Um, the patient's behavior is appropriate for the purpose of today. The facial expression is appropriate. The patient's speech is appropriate. The patient is dressed accordingly, and the patient has good personal hygiene. Moving on to the patient's head, I'm just going to go ahead and wash my hands first and don gloves. Looking to the patient's head, I can see that it's normal cephalic. There's no obvious signs of any lesions or masses to the head. I'm just going to go ahead and palpate here. Any pain or tenderness? No pain or tenderness to the head. There's also no infestation to the hair. Looking to the patient's face, I can see that the face is, the skin tone is even. There's no obvious signs of any lesions or abnormalities to the face. I'm just going to go ahead and palpate your sinuses here with maxillary, frontal, any pain or tenderness? No pain or tenderness there. And moving on into the patient's temporomandibular joint, I'm just going to go ahead and have you open and close for me, please. Any pain or tenderness there? No pain or tenderness in the temporomandibular joint. No crepitus was found. Moving on, I'm going to go ahead and take off my gloves and wash my hands. And I'm going to go ahead and move on to the patient's eyes. Looking at the patient's eyes, I can see the external ocular structure, that they are aligned symmetrically. There's no signs of abnormalities, any lesions to the eyes. There's no discharge coming from the eyes. There's no infestations in the eyebrows, eyelashes, or eyelids. Looking into the patient's eyes, I can see that there's no protrusion to the iris and the eyeballs. There's no discharge coming from the eyes. The eye color is brown. I'm just going to go ahead and pull down here. And the conjunctiva is pink. The sclera is white. I'm going to go ahead and test for Perla now. I'm going to dim the lights, have you focus on a distant object. I'm just going to go ahead and have you follow this pen light. So the patient's eyeballs are equal, round, and reactive to light and accommodate accordingly. Moving on into the patient's ears, I can see that the patient's ears are aligned symmetrically. There's no obvious masses or any lesions to the ears. I'm just going to go ahead and palpate on your ears here. Any pain or tenderness? No pain or tenderness. I'm going to go ahead and look into the external auditory meatus. And there's no redness or any swelling or any discharge coming from the ears, and the tympanic membrane is pearly color and pearly gray in color. Moving on to the patient's nose, I can see that the nose is positioned midline. There's no obvious masses or any lesions or any abnormalities to the nose. Just gonna go ahead and palpate any pain or tenderness. No pain or tenderness here to the nose. We're gonna go ahead and look in the nasal cavity. And to the nasal cavity, it's a normal red in color. It's moist. There's no obvious signs of any discharge, bleeding, or any foreign bodies coming from the nose. Moving on to the patient's mouth, I can see that the lips are pink, moist, smooth. There's no cracking, no lesions. The teeth are white. The gums are pink. There's no signs of dental caries. The buccal mucosa is pink and smooth and moist, and the tongue is also pink and smooth. And the patient's tonsils are present with a grade of 2+ and are pink without exudate. Moving on to the patient's neck, I can see that there's no pulsations. There's no masses or any abnormalities to the neck. I'm just going to go ahead and palpate here. Any pain or tenderness? No pain or tenderness to the neck. I'm just going to go ahead and fill on your lymph nodes here. Preauricular, postauricular, and cervical. Any pain or tenderness? Okay, no pain or tenderness. No pain or tenderness to the cervical lymph nodes. Moving on, I'm going to go ahead and check your carotid pulse here. And that's normal with a grade of 2+. So moving on, we're going to go to the patient's posterior thorax. And what I'm doing now is I'm going to look at the posterior thorax and I'm looking for any signs of scoliosis, kyphosis, or lordosis. I've noticed that the AP diameter is less than the transverse diameter. I'm also looking for any use of accessory muscle to breathe or any signs of masses or tenderness. I'm going to go ahead and palpate here. Any pain or tenderness? No pain or tenderness. I'm going to go ahead and have you say 99 on each touch. So the patient shows, the tactile fremitus shows symmetric sound vibrations. So now what I'm going to do is I'm going to go ahead and listen to your lung sounds with the diaphragm of my stethoscope. Starting with the left upper lobe apex, right upper lobe apex, and I'm going to the scapula and the vertebrae for the right upper lobe, left upper lobe, and after T3, I'm going to be going to the right lower lobe and the left lower lobe. So all lung sounds were heard, there was no adventition sounds heard, and the lung sound sounded normal. So moving on, I'm going to go to the patient's anterior thorax. And looking to the anterior thorax, I'm looking at the chest, seeing if he's using an accessory muscle. There's no signs of accessory muscle use. There's no masses or any abnormalities to the chest. I'm just going to go ahead and palpate the chest here. Any pain or tenderness? No pain or tenderness to the chest. So now I'm just going to go ahead and have a listen to the lung sounds with the diaphragm of my stethoscope anteriorly. We're going to start with the right upper lobe apex, left upper lobe apex. We're going to go to the second intercostal space for the left upper lobe, right upper lobe, fifth intercostal space for the right middle lobe, left lower lobe, and we're going to go mid-axillary for the left lower lobe and the right lower lobe. So all lung sounds were normal, no adventitious sounds were heard. Moving on into the patient's upper extremities. To the upper extremities, I can see that the patient's skin tone is even, the hair is distributed evenly. There's no obvious abnormalities, lesions, or anything like that to the upper extremities. I'm just going to go ahead and test your range of motion here. So I'm going to have you flex for me. That's normal at 160. And extend, normal at 0. And I'm just going to go ahead and rotate. And that's normal as well. I'm going to go ahead and test your muscle strength. I'm just going to have you do is squeeze my hand as hard as you can. And muscle strength is normal at 5+. Now I'm going to go ahead and fill on your radial pulse here. And that's normal at 2+. And I'm going to check your capillary refill. And that's normal with less than 2 seconds. So moving on, I'm going to lower the head of the bed. And I'm going to move on to the patient to lower than 45 degrees. And I'm going to move on into the patient's neck and heart. I'm going to look for the jugular venous pulse, and that's right above the sternocleidomastoid muscle, and it looks normal. Looking at the chest again, I can see that the patient isn't using accessory muscles. There's no masses. Any pain or tenderness again? No pain or tenderness. Now we're just going to go ahead and listen to the heart sounds with my stethoscope. First with the diaphragm. And I'm going to the second intercostal space for the aortic valve, second intercostal space for the pulmonic valve, fourth intercostal space for the tricuspid valve, and the fifth intercostal space for the mitral valve. So moving on, I'm going to go ahead and listen to the heart sounds again with the valve of my stethoscope, aortic, pulmonic, tricuspid, and mitral. So all heart sounds were normal. There was no murmurs heard in the heart sounds or anything abnormal heard. Moving on into the patient's abdomen. Looking at the abdomen, I want to get level with the abdomen and notice that the contour is normal. There's no obvious masses or any signs of abnormalities to the abdomen. I'm gonna go ahead and listen to I'm gonna go ahead and auscultate first with the diaphragm, starting in the right lower quadrant, right upper quadrant, left upper quadrant, and the left lower quadrant. High-pitched gurgling sounds were heard, which is normal. And I'm just going to go ahead and palpate in the same order. for rigidity or anything like that. We're going in the right lower quadrant, right upper quadrant, left upper quadrant, and the left lower quadrant. Everything's normal. Was there any pain or tenderness there? Let me go ahead and ask you when was your last bowel movement, and was it normal and consistent in color? So moving on, I'm going to go ahead and go to the patient's lower extremities. Looking to the lower extremities, I can see that the skin tone is even, hair is distributed evenly. There's no lesions or any abnormalities to the legs. I'm going to go ahead and just test your range of motion here with flexion, extension, and I'm just going to go ahead and rotate here. I'm going to go ahead and test your muscle strength. I'm going to have you pull on my hands and push on my hands. I'm just going to go ahead and feel your pedal pulse here. And that's normal at 2+. I'm going to go ahead and check your capillary refill. And that's normal with less than 2 seconds. So moving on, I'm going to go ahead and check the patient's sensory or neurologic. I'm going to have the patient stand up. I'm going to grab the cotton ball. And first what we're going to do is I'm going to have you name each spot that I'm touching you. Go ahead and close your eyes. Sit on the edge of the bed. And I'm going to have you name each spot that you feel the sensation. Head, cheek, chin, arm, leg. So now what we're going to do is we're going to do the Romberg test, and what I'm going to have you do is just stand with your arms to your side, and I'm going to count for 20 seconds. Go ahead and keep your eyes closed and stand with the arms to your side. So in the 20 seconds, I'm looking for the patient to see if he's swaying or if there's any signs of abnormalities. There's no signs of abnormalities. The patient wasn't swaying, staying straight. So that Romberg test would come back negative. And that would conclude our head-to-toe assessment. Do you have any questions for me? Okay, thank you.